Hey everyone, welcome to your lecture on sleep disorders. These are the learning objectives that we will be covering in this lecture. Start off with talking about benefits of sleep. We are very unfamiliar as nurses with sleep, right? Or nursing students especially, right? Sleep is a very abstract, concept, right? But it has a lot of benefits. It increases mental performance, it improves learning, it helps store our long-term memory, right? It restores energy, it improves the ability to cope with things, situations, especially challenging situations. It also keeps our immune system strong. That is sleep. What about rest? What is that, right? That is something that is not in the dictionary of a nursing student, I'm sure you're thinking, right? Like, what is it, right? It's relaxation, stress-free relaxation. Remember, physical inactivity does not equate to rest. Just because you're not moving around doesn't mean you're resting, right? It's a feeling of a physical calm. It leads to feeling refreshed. Mental, physical, spiritual activity that leads, somebody feeling refreshed and rejuvenated and ready to resume the activities of the day. Now, everyone is different, so obviously their way of finding that relaxation, that rest is different. Some people find rest through meditation, some through prayer, some, it could be anything, whatever the person finds relaxation with, right? What factors affect it? We have illness will affect it. Unfamiliar healthcare routines, like in hospital settings, at home they had certain routines. They didn't have all those alarms going off, the IV machines going off, the call lights going off, right? In hospitals, it's difficult for patients to rest, right? Emotional distress and stress can also negatively affect, our rest. These are some important terms you need to know and the stages of the sleep cycle. Please review this. It's extremely important for you to do that, and it's part of your anatomy information, right? Now, a loss of sleep, over here there's a picture also that you can refer to review your stages of sleep, right? Now, a loss of sleep, what happens when a person cannot sleep? Right? And maybe you're familiar with these signs and symptoms and you can recognize them, right? Confusion, even suspicion. That's, decreased immunity and metabolism. Your metabolism decreases. So when you eat, you gain weight, right? Mood, memory, and motor performance, is affected as well. Your equilibrium, your balance is also affected. Chronic diseases, sleep can lead to chronic diseases such as hypertension, cardiovascular disease, diabetes mellitus, obesity, depression. All of these can be caused by a lack of sleep or get aggravated by a lack of sleep. A person's blood pressure can be high just because they're not getting enough sleep, right? And it can also lead to a poor quality of life. Right? Light sleep and showing brain and body processes are associated with which stage of non-REM sleep? This is a question for you. So factors that affect sleep. Age definitely affects sleep. Lifestyle factors, physical activity, how much alcohol and caffeine a person takes, substance use, emotional stress, sleep habits, and hygiene also affect a person's sleep. Fatigue, how tired they are, their caloric intake. Illness can affect a person's sleep, right? Pain or discomfort, anxiety, depression, respiratory disease, cardiovascular disease, nocturia, all of these things can affect a person's sleep. Environmental factors like temperature and humidity. If it's too cold or too hot, a person finds it difficult to sleep, and most people prefer to sleep in a little bit more of a warm environment, right? The noise and light in the, area, any noxious odors around you, comfort of the bedding that you're in. Hospital settings can negatively affect sleep, right? Too much noises, too much sounds. You have a night shift, which is extremely loud. I'm sorry for those of you who are night shift, no bias, okay? And then medications, right? They can affect sleep as well, like hypnotics, antidepressants, stimulants, diuretics, because you're constantly peeing, right? Beta blockers, nicotine, benzodiazepines, which are sometimes given for sleep, actually affect a person's sleep as well, sleep patterns as well. Opioids affect them, and anticonvulsants. They all affect a person's sleep. right? Age-related factors for sleep are, they have sleep disturbances related to side effects of medications, any underlying chronic illnesses, depression, discomfort, nocturia, they get up at night a lot more to go pee, right? Pain can affect them as well, like chronic pain or acute pain. Declining levels of melatonin is age-related factor for older adults. This occurs in the latter decades of life. Other age-related factors, for example, college students, right? This might seem familiar to you, right? You stay up at night to study. You experience difficulty falling or staying asleep. That's because of the stress. Maybe you have an exam coming up about a grade and, your future. You're thinking about all these things and that stress keeps you up, right? A lot of times people prefer late night schedules because their family is asleep. Now it's quiet, so now they're going to sit down and study, so they don't get enough sleep. And they still have to wake up, especially those college students who have children, right? It's difficult because you have to wake up in the morning with your kids, right? So school schedules require them to attend early classes. For example, when you have clinicals, when you have lecture, lab, all these things, and now you have to wake up even earlier to attend those classes and labs. So common sleep disorders, let's talk about some sleep disorders now. So some of the common sleep disorders, one of them is insomnia. There are different types. You have acute insomnia, which is inadequate sleep hygiene, behavioral insomnia of childhood, insomnia related to medical conditions, right? There's the inability to fall or remain asleep or go back to sleep. That's called the definition of insomnia, right? The most common disorder, especially with depression and women, that's woman again, right? So 3 nights, if you're sleeping, you're not being able to sleep for 3 nights every week and for greater than or equal to 3 months, then you can be diagnosed with insomnia, right? It can be transient, which comes and goes, or it can be chronic, where you have chronic insomnia, right? Causes can be anywhere from illness, depression, anxiety disorders, stress, substance abuse, poor sleep, not poo sleep, poor sleep, poor hygiene, like practices. Right, symptoms that you will notice in people with insomnia is excessive daytime sleepiness, poor concentration, fatigue, lethargy, irritability, increased risk for depression, anxiety, and cardiovascular disease. Just not being able to sleep can cause all of that, right? So what is the treatment for that? We treat the underlying cause. For example, if the insomnia is related to an infection or a disease a person has, then you need to treat that disease process, right? And then if it's related to stress, then we want to help reduce stress factors, right? And you have behavior and pharmacological therapy for insomnia. Another common sleep disorder is sleep apnea. This is, it can be obstructive sleep apnea or central sleep apnea. So what is obstructive sleep apnea, right? It's caused because of an obstruction somewhere, right? So we use the term OSA for that. It's the cessation, the stopping of airflow. So the muscles of the oral cavity and throat relax, your upper airway gets blocked, and the nasal airway, diminishes or stops. And then you notice the person is snoring related to movement of the abdominal or chest movements. It's excessive daytime sleepiness, EDS. Right? Central sleep apnea is the dysfunction of the respiratory control center in the brain. Impulsive breathing fails, right? There's saturated oxygen decreases. It's common in patients with, strokes, obesity, and muscular dystrophy. The causes of sleep apnea most commonly are airway occlusion, right? Risk factors include obesity. You'll notice that sleep apnea is a very common thing, in patients who are obese. Hypertension, heart failure, smoking, age greater than 65, alcohol use, nasal structural abnormalities. Large people with large neck circumferences are also at risk for, sleep apnea. And, menopause in women, they're also at high risk for sleep apnea. Symptoms include dysrhythmias, myocardial infarctions, which are heart attacks, Strokes, hypertension, motor vehicle accidents also are symptoms of it, right? Related to sleepiness, right? They fall asleep at while they're driving, right? And then you have depression, worsening of ADHD for those patients who have ADHD, headaches, accelerated aging, people who age faster, and that's because of sleep apnea, right? So treatments include the CPAP, the BiPAP, implanted upper airway stimulators, right? Nose tape, surgery. The nose tapes help with opening up the nasal areas a little bit and then help with, the snoring, right? And other sleep, common sleep disorders, they can be caused by, circadian rhythm disorders, right? Abnormality in the sleep wake times. For example, jet lag. When you go to a different country and you come back, you have that jet lag, you have that long flight, right? Right. Then you have working night shift. People who work night shift, or rotating shifts, like they work nights, then they don't, then all of a sudden they'll work a day shift, or they work night shift, they go to school during the day. All of those can cause, circadian disorders. Then you have hypersomnia, excessive sleeping, especially during the day. This is sleep related or disease. It's sleep related or it can be disease related. For example, lack of sleep can cause them to sleep a lot during the day, or it can be a disease like maybe sleep apnea or something like that, right? It can be related to depression as well. Then you have narcolepsy. Narcolepsy is a dysfunction of processes which regulate sleep and wake cycles, right? They have excessive, daytime sleeping, right? The EDS, excessive daytime sleepiness, right? Uncontrollable episodes of sleep during the day, right? So they can't control it, they just fall asleep, right? And this can happen suddenly when the patient's in the middle of an activity, right? This creates a huge safety risk because imagine they're driving and then all of a sudden, uncontrollably, they just fall asleep, right? Because it's a disorder of their, of their processes that regulate sleep and wake states, right? So the way we can, it creates a huge safety risk. If you notice, I, put in all caps, right? So what is the treatment of, narcolepsy? Encourage the patient to take 20-minute regular naps, not more than 20 minutes, just about 20 minutes, right? You don't, just, do regular exercise, eat a diet high in protein, right? Eat smaller meals, don't eat large meals. Teach them deep breathing exercises. Chewing gum can help as well. Make sure they're getting enough vitamins. Avoid factors that increase drowsiness. For example, heavy meals, alcohol, exhausting activities, long distance driving, long periods of sitting in hot or stuffy rooms, right? So we want to encourage that as well. So other common sleep disorders are parasomnias. For example, sleepwalking, talking. This occurs in stage 3 and stage 4 of sleep. 1 to 2 hours after falling asleep, and when they wake up, they're not aware of it. They don't even have any memory of it, right? Then you have bruxism. It occurs in, stage 2 of non-REM. It's the grinding and clenching of teeth. You hear them doing that in their sleep. Then we have night terrors, it happens in children. They start crying and they scream, they act out. It lasts for about 10 to 30 minutes. It's, they're difficult to awaken when they're going through that, right? And then when they wake up, they have no memory of it, right? Then REM sleep behavior disturbances is where the person acts out in their dream state, right? They're dreaming and then they act out in their dream state. And enuresis is nighttime incontinence, right? When they wake up at night and they, they actually don't wake up, they're sleeping and they just, wet the bed. That's nighttime incontinence, right? Another common sleep disorder is restless leg syndrome. It's uncontrollable movement of legs during sleep or rest, right? It's a central nervous system disorder. It's common in older adults. It can be caused because of low iron levels or antidepressant use. Symptoms is creeping, crawling, itching, tingling sensation in the legs. And it helps when they move around or they get up and stand on their legs, and then it helps. It helps relieve it, right? Periodic limb movement, right? Flexing, twitching of limbs when they're asleep. You see some people, they kick or they twitch when they're sleeping. That's also restless, can be restless leg syndrome. They often patients are, and people are unaware of it, right? Because unless, their spouse is on the bed with them and, they twitch and they hit them, then the spouse says, oh, you know, they notice that, right? Otherwise, you're asleep, so you don't know that. Treatment is to decrease alcohol, tobacco, and caffeine use, maintain regular sleep patterns, regular exercise, foot wraps or pads. Medications include, maybe it's, deficiency in iron, so maybe iron or benzos or anticonvulsants or dopaminergics. These medications can also help with, restless leg syndrome. Another secondary sleep disorders can occur, because of depression, hyper or hypothyroidism, pain, sleep-provoked disorders, right? Coronary artery disease, they have increased heart rate, angina, ECG changes, asthma, and bronchospasm. So when you're not, you have a sleep disorder, these are disorders that can happen from your sleep disorder, your sleep disorders can happen because of these disorders. For example, coronary artery disease, asthma, COPD, diabetes, gastric ulcers, epilepsy. All of these can cause secondary sleep disorders. Okay, sleep deprivation. There you go. You're familiar with it, I'm sure. It's not a sleep disorder. It is a human response to prolonged sleep disturbances involving both your non-REM and REM cycles, deprivation of both, right? Physical symptoms, blurred vision, ptosis, fine motor clumsiness. Like sometimes we feel, oh my God, I'm so clumsy, right? This can be caused from just a lack of sleep. Decreased reflexes, slowed response times, right? Decreased reasoning and judgment. Hey, that can affect your test-taking abilities, especially with those nursing NCLEX questions, right? So you need to make sure you get your sleep. Cardiac arrhythmias, right? Psychological symptoms include confusion, disorientation, increased sensitivity to pain, irritable, withdrawn, apathetic, agitated, hyperactive, decreased motivation, excessive sleepiness, right? Etiologies are illness or hospital, and when you're in the hospital settings, especially critical care units, patients, there's so much noise is going around and they feel very sleep deprived. Here's another question for you. One more. So do's and don'ts of sleep. Things to do. Use your bedroom for sleep only, right? People who tend to have their offices in their bedroom, they have difficulty creating that line, that line between sleep and rest, sleeping, resting, and work. So follow a regular routine. Go to bed each night at the same time. Try to make it a practice to go to bed at the same time. Keep the bedroom as dark, cool, and quiet as possible. Try a weighted blanket. Sometimes a weighted blanket helps, to relieve any twitching and stuff people might have. If you can't sleep within 30 minutes, get up and do something, but non-stimulating, right? Don't start, browsing TikTok videos or watching TV or something, because that's considered stimulating, and so you're going to have more difficulty sleeping. Use relaxation techniques. There are a lot out there, like deep breathing, things like that, or maybe calming sounds like sounds of nature, things like that. Those things help people to fall asleep. Things we need to avoid. These are extremely, extremely important for you to remember. I'm just saying, right? So things to avoid include exercising within 3 hours of bedtime, taking long naps of greater than 20 minutes, or napping in the evening, because that's going to, mess up the circadian rhythm. Catching up on sleep, right? You're like, okay, I didn't sleep last night, so I'm just going to catch up and sleep all day, right? Sleeping aids, right? You want to avoid sleeping aids. You want to avoid screen time before you sleep, right? You want to avoid medications containing stimulants, like cold medication. Antihistamines are stimulants. You want to avoid caffeine, tobacco, alcohol, and heavy meals right before bed. You want to avoid too much carbohydrates right before bed, because they create energy, right? You want to avoid overhydration, because then guess what? You're going to pee a lot at night, right? Going to bed angry or frustrated, because stress and those emotional stress does not help with sleeping. Sleep aids are, prescriptions such as non-benzodiazepines like sedative hypnotics that have a short half-life, for example zolpidem, tartrate, Zelpon, benzodiazepines such as they're sedative hypnotics, first-line treatment, short and long-acting. They can cause a lot of daytime drowsiness and dizziness in older adults. They're dangerous when combined with alcohol because alcohol makes the effect even stronger, right? It's formulated for anxiety, for example diazepam, alprazolam, or lorazepam, but it also sometimes it helps people fall asleep as well, right? Others are selective melatonin agonists, barbiturates, tricyclic antidepressants. Non-prescription medications are antihistamine because they can cause confusion, drowsiness, but they can create a high fall risk, right? Natural sleep aids include melatonin, chamomile, valerian root, kava, cannabidiol, and magnesium. These all can help with sleep as well. So the hospital environment, how do you control the hospital environment? How do you maintain it to help people sleep, promote sleep in patients, right? Close the doors to the patient's room when possible. If the patient's a fall risk, obviously you don't want to do that. But if they're not, close the door so you minimize that noise, right? Keep the doors to, work areas on the unit closed when in use. Reduce volume of nearby telephone and paging equipment. Wear rubber-soled shoes. Avoid clogs, those really loud ones. You can hear the nurse walking to your room from, maybe from like miles away. Avoid those kind of shoes, especially if you're night shift, right? Turn off bedside oxygen and other equipment that's not being used, right? Don't just leave it on so it can constantly make that noise. Turn down alarms and beeps on bedside and monitoring equipment if that's a possibility. If it's unnecessary to be there, then just turn it off, right? But if you need that on, then you need that on, right? Especially in critical care patients. Turn off, room television and radio unless the patient prefers soft music. Avoid abrupt, loud noises such as flushing a toilet or moving a bed, right? If you really want to, reorganize a room or clean a room or do something, please don't do it at night. Let the patient sleep, right? Keep necessary conversations at low levels, particularly at night. Once, if you're at night shift, if you're going to watch Netflix, then, just keep the volumes down. Just kidding. Okay, designate a time during the day for quiet time for patients. And actually, a lot of hospitals have that. They have the no disturbing sign, times. Like I think it's like 2 to 4 or something in the afternoon, or something like that, where they try to keep everything quiet. Now, nursing interventions and cues that we can, recognize in patients. You want to know their sleep history, their patterns, their rituals for sleep, their sleep habits, environmental, the environment that they live in. Any changes in their lives recently, any problems? Do they take any sleep aids? Help, encourage them to describe how they sleep, right? Any sleep problems that they have, right? Find out, when it happened, how long, has it happened, if you have insomnia, you're not able to sleep at night, how long has that been going on? How long, what triggers it? Any predisposing factors, right? Effects on the clients. How does it affect you as a person when you cannot sleep, right? Try to understand that about the patient. Physical and psychological illnesses that they have, any stressors that they have going on. These are some tools here that you can use. It's Epworth sleepiness scale or Pittsburgh sleep quality index. You can click on that link and view those tools that you can use to assess a patient's sleep, right? And what actions do we want to take? What are our nursing interventions? You want to cluster nursing care and schedule nursing care, right? If the patient has medications, cluster the care, right? Do a couple of things at the same time. Don't go in and say, okay, this is one med, okay, then you go out, oh, you know what, I forgot to give you this, and then you go out, and then a few minutes later, oh, you know what, I need to do your wound care, let me do that. Okay, now I came to clean you. Instead of constantly going in and out, cluster the care, right? Do it together. You go in, you administer the meds, you get the wound care done, you get them cleaned, things like that, and now they can have a good amount of rest time before you show up again, right? So then create a comfortable, restful environment, control the noise, temperature, lighting, promote comfort and relaxation techniques, support bedtime routines and rituals, maintain safety for the client. Like if there are a person who's going to pee at night or a fall risk, they're on diuretics, whatever it is, maintain a safe environment for them. Make sure there's adequate lighting, maybe a night light or something. Offer foods that help promote sleep, right? Maybe a glass of warm milk or something like that. Those things help people to fall, relax and fall asleep. Educate them on sleep hygiene, like sleep patterns, hygiene, habits, bedtime routines. Teach them to avoid caffeine, nicotine before bed, avoid stressors before bed, right? Administer, or complete client teaching about sleep inducing medications. So if they're on any medication, teach them about those medications. Make sure you teach them that those sleep medications need to be taken when you're getting ready for bed, right? Don't take them like way before bedtime, because then they're going to start feeling drowsy, they're going to sleep, and then they're going to stay up at night. So they should be taken when the person is about to go to sleep, because some of those medications have severe side effects and we don't want the patient to experience that. So they need to take the medication when they're going to go right to bed, and they're going to have a chance to sleep for at least 6 to 8 hours. Okay, need a nap? Just kidding. Well, that's it for your lecture on sleep disorders. I will see you guys in class.